Salam and welcome to part number 5 in ADHD. Just a reminder, attention deficit, high activity. That's ADHD. Very, very common. More than 400 million people all over the world have ADHD. Main thing about the series is to share knowledge, to inform and educate parents and those who don't have ADHD in the house, but mainly for the teachers and educators. ADHD is very common and the role of the teachers very, very important. But because of ignorance, we have stigma. So please, let's remove the stigma. Let's end the stigma. It does not mean there's something that kid is crazy or something wrong with the kid. We must understand it is either a neurodiversity problem or a brain development problem or a neurodevelopment problem. But it's just like similar to kids having different milestones. Different kids have different talents. Different kids have different skills. Doesn't mean that if a kid doesn't do well in maths and science that there's something wrong with the kid. And please, our teachers and educators, please don't traumatize our children. Please don't tell our children that they are stupid. As what I say in my amazing brain workshops, I've had so many adults. I've spoken to adults who are 50 and 60 years old. I said, why haven't you really done much in your life? They say, when I was young in school, my teacher told me I was stupid. Imagine a 50-year-old beautiful woman. She thinks she is stupid. And I said, why? She said, no, my teacher told me. She made me stand up in the middle of class and she told me she's stupid. So please, teachers, don't embarrass our children. Don't make them disabled. Don't give them brain disability by telling them they are stupid, by putting their brain in the cage. We all got different abilities. We all got different skills. And that's what I used to do in my whole brain workshops. There is different types of intelligences. Please, teachers, don't put our children's brain in a cage by saying that they are stupid. Let's leave these. Don't humiliate your child in front of the class, please. Especially the child got ADHD. Try and understand what is going on. Others, we as teachers, we are causing more problems for our children who have various types of issues. Maybe there's a problem at home with grief or other problems. So let's get to today's topic. And the main thing is, we're talking about ADHD. And today's session, we are in video number 5. Part number 5. Is it number 5? Okay, there we go. There we are at part number 5. Okay, we've done 4. Today we're busy with part number 5. Right. What to know about ADHD screening for your child. If you're having your child screened for ADHD, take these steps. So screening for ADHD, there's a certain few steps that you must follow. 1, go to the right professional. Go to the person who understands ADHD. Go to people who know, like as we said previously, and I'm going to go through this journal in the next few videos, is by I'll use them as names, Professor Renata Skuman and Professor Tony Voges, or Doctor and Professor from Stellenbosch University, a fabulous article in the South African Journal of Psychiatry, and I'll go through that as well. So go to professionals like this, or go to medical doctors, or go to ADHD experts or counselors who are dealing with it. They are experts in their field. So first and foremost, go to the right professional. The best thing you can do is to find a healthcare professional with expertise in ADHD. Your child's school might have someone on staff who can evaluate them. I know in first world countries they are fabulously advanced, but here in third world countries or in developing countries like South Africa, we're finding it difficult. In Afghanistan, they're finding it difficult in various parts of India. India got some places that are advanced, other places were very, very difficult rural areas. Pakistan, many places got difficulty in a lot of rural areas. Bangladesh is struggling. Many places in Africa are struggling, really, really struggling. Kenya, Nigeria, Botswana, Malawi. These areas are really, really struggling. Okay, so go to the right professional. Other options include a child psychiatrist or a psychologist. You can also ask your pediatrician to give you references as to who to go to. Main thing is ask a lot of questions. You must ask questions. Please ask questions so that you understand what ADHD is. And that's the reason why I'm doing this program, because sometimes the doctors are so busy. They give you a short time, but you need an hour's time to sit down and talk to that professional. So I'm talking with you as if you are my patient. So over these videos, I'm giving you all the possible questions you've got in your mind, and I'm giving you answers for that. So because I'm generally a patient listener, but because I don't have a practice anymore, I'm giving you my time and I'm sharing knowledge with you. So I'm giving you the answers that you as a parent, you are struggling with, or if you as a child, you got ADHD, please watch this program. If you are a teacher, please educate yourself about ADHD and let's remove the stigma. Let's educate ourselves. Knowledge is light and ignorance is darkness. So second, ask a lot of questions. Include your teacher. Your teacher is a vital part of the team. The teacher is a team member. So you're a team member, your child is a team member, your teacher is a team member, and the professional, your doctor is a team member. So include your teacher. and then expect more than an ADHD drug for therapy. Drugs is not a cure-all for everything. You can't just say, I'm going to pop a pill and problem is solved. No, you first need to understand the condition. It is a neurodevelopmental problem. It means it's a problem with the development of the brain. This frontal part of the brain is known as the frontal lobes. These are involved with executive functions. Executive functions mean if something is happening in the environment, I'm going to decide about my behavior, my conduct. Is my behavior in keeping with it? Am I treating myself as a well-mannered person? There are certain rules of social conduct. If someone is standing in the queue, you don't jump the queue. That's a rule. But if your executive function is not working well, that child is just going to jump the queue. Executive function means if the teacher or someone in authority says, or the chairman of the board says, okay, all right, we are starting now the meeting. Can everyone settle down? Everyone will settle down. A person with ADHD will still be drinking tea, will still be on the cell phone. Why? Because they don't have that executive function. So this part of the brain, the executive function, is very, very important. So it's a neurodevelopmental problem which affects the behavior and conduct of the situation, where other people will say, why is that person acting so strange? So the person is acting unusually strange, like as if there's something wrong. So, but there is a problem with the development, the executive function. This is where the difficulty is. So the next point is stay on top of the changes. Monitor your child's medications and behavioral plan as they get older. The medications that they use and the dosages may need to change as they grow older. Some kids have a harder time focusing as they enter middle school, as they enter high school, and they start changing classes, or maybe they change friends. Excuse me. Then you're going to do certain brainwave tests with the EEG, electroencephalogram. Because it is a brain developmental disorder, scientists have been doing brain scans for decades with EEG. One large study showed, analyzed decades and decades of research, found that people with ADHD have lower levels of brain arousal. Lower levels of brain arousal here in the frontal areas of the brain where the executive function. So this part of the brain is not working too well. This is executive function. As well as too many theta waves, the slow brain waves, and not enough beta waves. Beta waves is when you need to be a functioning alert. So if you don't have much beta waves, your beta waves makes you alert. So if you don't have much beta waves, the person is won't be concentrating, And if you have too much beta waves, your motor is running too fast. You're you're idling in neutral, but you're revving the engine. You're revving the engine all the time. So after an ADHD diagnosis, then what? What do you then do? Okay, so what you then do is that if your doctor makes an ADHD diagnosis, it's important, very important, to follow the treatment plan. The treatment plan is not only the medication. The treatment plan is a combination of medication and behavioral changes. So behavioral changes are more important than the tablets you're going to pop into your mouth. Remember, changes in behavior are more important than the tablets. Both are important. In some cases, you always start off with behavior. Don't start with tablets. Unless it is a very serious advanced case, your doctor will decide. But in 90% of the cases, you start off with changes in behavior. Get your parents involved. Get the siblings involved. Get the grandparents involved. Explain to the grandparents what this is all about, and how their help is very important, because grandparents are patient. They are listening. They will sit down with coloring paper. So get the grandparents involved. Very important. Involve your child in the treatment plan as well. Talk to your child with age-appropriate language. This is very important. Having ADHD does not define who your child is. Don't say my child is broken. No, your child got certain other intelligences and we need to find it. So please watch my program where I talk specifically about it. The title of that video is called ADHD IQ. IQ stands for intelligence, but there's different types of intelligences, and I will talk about that in detail. So the lesson for today is that ADHD is a common brain disorder, but the knowledge of that is we don't know much, because the people don't know much, and in our country, because the educators don't know much, and because of that, there's a lot of stigma around it. So we need to remove the stigma. Unfortunately, there is no single ADHD test to determine if you or your child has ADHD. You cannot take your child for a blood test to say you got ADHD. So it's a very complex situation. It takes a lot of questions. So it's a history. A detailed history taking is very, very important. But by ruling out other possible causes and using screening tools and rating scales, your doctor can diagnose ADHD to help you move forward with a treatment plan. So, my kudos and strength to all the mothers and fathers who got ADHD patients in the home. I give you all due credit. Only those people who got illness in the home, they know what they are going through. People who got a disability in this house, they know what they are going through. If you've got an illness in your home, you know what you are going through. Other people will just be politely, how are you? Fine, you okay? That's fine. But for 24 hours, you are living with ADHD. With 24 hours, you are living with diabetes. Or for 24 hours, you are living with poverty. Those people who are suffering with poverty, only they know what they're going through. Or for 24 hours, you're living with disability, or with a heart problem, or with epilepsy. So the parents are the ones who are the caregivers, but they are suffering the most. So I always tell people, after you finish inquiry, many people phone, how's the patient? How's the patient? I say, fine, you're asking about the patient, but always ask, how are you doing? Always ask the caregiver, how are you doing? Because it's a great strain on the caregiver. Imagine what the mother is going through, or the father of someone who's got ADHD. So we must share our love, not only with the patient who's got the ADHD, but share our love with the mother who's looking after the ADHD, with the father who's looking after the ADHD, with the grandmother who's looking after the ADHD, with the grandfather, with the brothers and the sisters and the teachers and the educators and even the doctor. Share your love also with the doctor as well. Stay well, look after yourself, share, let me know your thoughts, look after yourself. Alhamdulillah.